Okay, I'm gonna have you take a few steps towards me. Just walk normal. All right, turn around and keep on walking. I'll tell you when to stop. I see a little bit of pronation there. Go ahead and turn. And I'm going to just take a look at your shoulders. You are having some neck pain as well, right here in the back. Definitely there is an elevation on the right upper shoulder area.
Yeah,
It's
I've always
imbalance.
noticed like this little bone here is kind of higher than the other side.
That's just muscular. It's how you're tensing your muscles, and probably you're trying to compensate. Okay, go ahead and raise your right arm. Okay, so I'm gonna press down on your arm.
Okay.
Try to keep it up.
Okay.
Okay, and resist. Okay, let's go ahead and do the same thing on the other side. So try to resist. Okay, a little bit of decreased motor texture there. Okay, can you try to touch your chest with your chin? Okay, your head is going to the left side. Are you noticing that? It's not going center. Okay, lift it back up, and now try to hyperextend. Again, you're going to the right side instead of going center. Okay, come back to center. I'm going to touch some trigger points on your face. Let me know if you feel any kind of pain. No. Okay, good. I'm going to have you turn around. I'll take a look at your spine now. Okay, I'm sorry, my hands are a little bit cold, but I'm just gently pressing down on the spine level, feeling for any inflammation. Also looking at the curvature, see if there's any deviation, any angle differences. It does feel kind of tight. I would say it's symmetric on both sides, and that can explain the angle. You are turning naturally towards your left side. Okay, with your left arm, I'm going to have you touch exactly this point that I'm pressing down right here. Very good. Okay. Any pain when I'm pressing down in the middle of your palm?
No.
Okay. Just going to go ahead and gently press down under your scapula, checking for mobility here. Okay, and now I'll do the same thing with the right arm. How does that feel? Any pain?
Good. No. No pain.
Go ahead and come back to center. And you did mention that your pain is mostly in the upper side here. So it does sound that it's muscular. We can definitely do a trigger point massage and just an adjustment to put your spine back to center. And after that, I'll give you some recommendations that you can definitely do on your own to increase spine mobility.
Okay.
All right, let's take a look at your hips now. And for this, I'm gonna have you lay down, face down first, okay? There's definitely some imbalance that comes from the hips as well. Dysplasia on the right side. Go ahead and lift your right leg up only. Okay. Put it back down. Left leg. Put it back down. We can definitely start with a scalp first. I'm going to apply some anti-inflammatory oil. So let's first warm it up. Okay, you're going to feel the oil on your neck. We're going to try to work on the base of the skull as well. Release some of that tension that's backing up. Sometimes it can even cause tension headaches. Applying gentle pressure on the occipital lobes. This is going to feel a little bit cold. I'm going to apply more oil. So this is going to go mainly in the middle of your back. And releasing some of the knots from the right shoulder. This has helped. It's going to help to increase mobility. Some redness is definitely normal. This is kind of like a wake-up call to the muscles. This helps to bring circulation. This helps to de-stress the muscles. Sometimes they seem to be clenched in one position. It's very hard to relax them. So hopefully today we're going to be able to realign your muscle movement and increase their flexibility. I'm just going to slowly increase strength here. Let me know when it gets too much. There are definitely different levels. Everybody is different. It feels really good. I'm glad. Okay, I'm going to start decompressing the muscles that connect your scapula to the main muscles close by the spine. moving down the body and just trying to move all the muscles before we do our adjustment. Moving down the leg area. We tend to tense a lot the calves whenever we have upper neck pain. So making sure that we are distressing these muscles as well. I'm going to go ahead and apply a little bit of oil on your soles. No, I'm just massaging the heels. Applying gentle pressure here. I did notice some swelling generalized, so we're going to go ahead and activate the lymphatic drainage as well. working on the cervical nodes to liquidify some of that lymph, making sure that it is properly eliminated. Okay, we're going to go ahead and take a deep breath in and breathe out. Okay, now I'm going to ask you to lift your legs up. Just bend them from the knees. There you go, both of them. And keep them like this. And on the count of 3, I'm going to have you hold your breath, okay? 1, 2, 3. Breathe in and hold it. And breathe out. And you can relax your legs as well. Okay, I'm going to have you flip over on your back now. Okay, Ivy, let's go ahead and take a look here and see what your neck feels like. And definitely a lot better. I'm going to have to check your alignment at the end to make sure that it looks good. So we're going to have to work more on your right side. Okay, go ahead and take a deep breath in and breathe out. Good. Okay, we'll do that one more time. Breathe in and breathe out. Okay, perfect. Let's go ahead and work on your arms. Breathe in and out. Okay. Take a deep breath in and breathe out. Okay. I'm gonna go ahead and let's go ahead and just stretch your legs, make you a little bit taller. Okay. Okay. Perfect, a little bit better. All right, I'm gonna have you sit back up. You can keep the tape on even when you shower. I'm going to go ahead and use it on the parts that it's really hard to massage those areas so that everything stays in place.
Hi, Amanda.
Hi.
My name is Dr. Mad. I'm going to do your exam.
Nice to meet you.
Nice to meet you too. Thanks for coming in. Since I don't have medical records for you, can you please state your full name and your date of birth? We're just going to create a new file for you.
It's Amanda Jackson and July 2nd, 2000.
Okay. Do you have any allergies to medications?
Nope.
Okay. And when was your last physical?
About a year ago.
Any concerns that you would like me to address today?
No, just like a yearly routine.
Okay. Are you taking any medications on a daily basis? When was your last gynecology exam?
Last year.
Okay. What about dental?
Like a few months ago.
Okay. Alright. Do you wear contacts?
Yes.
Okay. When was your last eye exam?
Maybe 6 months ago.
And how often does your prescription change?
It doesn't really change that much anymore.
Okay. Alright. Have you noticed any bumps or itchiness or eczema on your body?
No.
Okay. And are you experiencing any blurry vision, any peripheral vision loss, double vision? Okay. Have you noticed any changes in your voice?
No.
Any flu-like symptoms?
No.
Okay. Any changes in your muscle tone or balance? Okay. Are you experiencing any pain right now?
No, not really.
Okay. And have you had any surgeries in your lifetime?
Yes, I have.
Okay. What surgeries?
I had surgery on my elbow.
How long ago was that?
Like 15 years ago.
Okay. And which elbow is it?
Left.
Was that from an accident?
Yes.
Okay. Any other injuries?
No.
Okay. How many hours per night do you sleep?
Like 7 to 8.
And is that enough for you to feel rested in the morning?
Yeah.
And what kind of diet do you have?
I'm a vegetarian.
Okay. For how long have you been
10
vegetarian?
years.
Are you taking any supplements?
No.
Okay, we're definitely going to check your B levels. It's very common for vegetarians and vegan people, those who follow a plant-based diet, to have a deficiency in the vitamin B. So we just want to make sure that everything looks good. Do you drink coffee?
No.
And what about alcohol?
No.
And do you smoke?
No.
Perfect. Let's see. Family history. Do you have any family history of heart problems?
No.
All right. I believe I have everything. Let's go ahead and start with your vital signs. I'm going to take your temperature. Have you noticed any flu-like symptoms in the last 48 hours?
No.
All right. 96.4 Fahrenheit. And I'm going to check your blood pressure. Is the left arm okay?
Mm.
All right. Perfect. I'm going to have you relax and uncross your legs. Okay. This will go on your arm. Blood pressure is 110/70, which is very normal. I'm going to go ahead and slide this down. Let's go ahead and check your pulses. So I'm going to put 2 fingers on your wrist.
Mm-hmm.
Okay, now I'm just going to go ahead and compare. Good. Strong and symmetric. Temperature was 96.7 Fahrenheit. Respiratory rate is about 16 per minute. Blood pressure 110/70. Heart rate was 75. Alright, perfect. I'm going to start with a vision check. Go ahead and look straight here at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation. Good. I'm just going to go ahead and lower your eyelid and take a look and see if there is any yellowish discoloration. Okay. I'm going to have you close your eyes and I'm going to try to open them. Don't let me do that. Good. Now go ahead and lift your eyebrows. I'm going to try to push them down. Don't let me do that. Okay, perfect. Now go ahead and look right here. All right. Now look here. Okay. Go ahead and give me a big Not seeing any redness. Tongue looks pink and symmetric. Go ahead and give me a big smile. Good. So that's symmetric. And now frown for me. All right. And buff your cheeks. Keep them buffed for me. Don't let me unbuff them. All right. Relax. A little bit of asymmetry there on the right side. We're going to check your muscles there too in just a second. Let's go ahead and check your nose now. Okay, I'm gonna have you look up.
So we're looking for obstruction. Okay, that looks good. That looks normal.
Let's go ahead and check your ears as well. I'm gonna have you look towards your right side and relax.
The tympanic membrane is pro-gray. There's no signs of infection. A little bit of obstruction here. We could definitely go ahead and remove some of that earwax. I'm going to take some measurements. So first we're going to start with head circumference. Good. Going to check the shoulder length.
Okay. And just go ahead and extend your arm like this. I'm going to measure your arms. And the other side. Okay. And now check the circumference of your arm. So we're looking to see if there is any asymmetry in between them. Okay, I'm going to check your waist as well. Go ahead and place your arms a little bit to the side. Okay, good. And relax. Okay. Perfect. I'm going to check your reflexes now. So we're going to start with the jaw. I'm going to have you relax your jaw a little bit. So kind of like this. Perfect. Okay, good. Okay. Go ahead and relax your elbow. This is the elbow that you had the accident on. Okay. Good. Relax. Okay, relax your arm. Good. Perfect. Okay, wonderful. So I'm gonna have you turn around and I'll take a look at your back now, okay? I'm going to go ahead and put gloves on. And first I'm going to take a look at your back. Now put your hair up in a bun just so that we can take a look at the spine. Sorry. start by palpating, looking at the cervical spine. Noticing a little bit of lordosis and the thoracic area. Let me know if you experience any kind of pain as I'm pressing down. And I'm not noticing any other signs of abnormal curvatures. No scoliosis. Doing some measurements on the upper spine. It's going to feel a little bit cold. Slight swelling as I'm moving up the cervical spine. And it diminishes as we're going towards the thoracic area. Slight asymmetry between left scapula and right. So I'm going to keep an eye on that and see if it changes in the next 6 months. I'm going to touch you on the right and left side of your spine. Go ahead and tell me if you feel this on the right or left.
Right. Right. Left. Left. Right. Both. 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 Right. Left. The middle. The middle. The middle.
Okay, that was very good. Next, I'm going to draw some shapes and letters that are pretty common. So I need you to tell me if you can distinguish, and we're looking at how well your brain can perceive the stimulus. This is going to feel a little bit wet, okay?
Mm-hmm. The circle. Two. Oh, there's more. A square. An A. I don't know.
Okay.
A V. I don't know.
Okay.
A C. A V.
All right. That looks good. I'm going to go ahead and wipe that. Okay, perfect. Okay, I'm going to go ahead and remove the ponytail, so we're going to take a look at your scalp. Looking for any lice infestation, also eczema, and any skin disorders that we can definitely treat very easily in the office. So I'm not noticing any signs of parasites. We can go ahead and just take a look at the skin. Okay, I'm gonna have you lay down, and I think that's when I'll be able to take a look better at your scalp. I am noticing a little bit of redness. Any increased itchiness or dryness of the scalp that you've noticed?
A little bit, yeah.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Cold. Cold.
And did that change in intensity?
No.
Stay the same, okay. Now go ahead and tell me if you feel this sharp or dull.
Sharp.
And do you feel this sharp all the way?
Yes.
Did that change in intensity?
No.
I'm going to take a sample and we're going to send this to the lab. Since I'm noticing that redness, I just want to make sure that there's nothing concerning. And if there is, we're just going to get a proper treatment and know exactly how to heal it. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
And does this feel cold or warm?
Cold. Warm.
And do you feel this sharp all the way?
Yes.
What about now?
No.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
Now.
Good.
Now. Now. Now.
Okay. I'm going to palpate your ears first, and then we're going to check for any auditory deficiency. We're checking for mastoiditis, which is the bone right behind your ear. Sometimes the only sign of that type of infection is just some tenderness that is behind
bone, and there doesn't seem to be any inflammation. Going to slowly palpate your ears. I'm not feeling any nodules, which is good, on both left and right. Go ahead and tell me with which ear you hear the sound.
Right, left, both.
Okay. Now go ahead and tell me when you don't hear the sound anymore.
Now. Now.
And tell me which position here is louder, position A or B. So this is position A, and this is B.
B.
And this is position A and B.
A.
Kind of slowly palpate your nose and then moving to the sinuses. I'm not feeling any swelling. And there's another set of sinuses right in between the eyebrows, a little bit above. Hairline looks intact. I'm not seeing any signs of alopecia. Checking lymph node placement to see if there is any signs of inflammation. We're looking for any nodules. So we're palpating preauricular lymph nodes and postauricular. Also submental right under the chin. I'm going to check for any TMJ disorders. So I'm going to have you slowly open your mouth as wide as you can and slowly close it as soft as you can. I'm not feeling any clicks there. Normal hair distribution of the eyebrows. Eyelashes also look normal in size. The eyes are symmetric. Not feeling any swelling around it. Good. We're going to go ahead and check your sense of smell. So that's your olfactory nerve. I have here an essential oil smell. Go ahead and try to take a deep breath into your nose and out through your mouth. And see if you can identify that smell.
I don't know what that is.
Okay. I have here a few more so we can definitely make sure that the test is accurate. Go ahead and see if you can identify that.
Mint.
Okay, that was close. I do have one more. What about this one?
I don't know what that is.
Okay. Let's go ahead and check your taste. I'm going to place a drop of this essence on your tongue. I'm going to have you identify it, okay?
Mm-hmm.
Go ahead and open your mouth. Good.
I don't know what that is.
Okay. We're definitely gonna have to do more tests and see exactly why that is happening. I'm going to go ahead and check your abdomen and skin now, okay?
Mm-hmm.
I'm going to go ahead and listen to your heart. Okay, I can hear only S1 and S2, no S3, no S4. We're listening for any murmurs now. I'm gonna have you take a deep breath in and hold it for 3-4 seconds, okay? And hold it. And breathe out. Okay. Everything looks good. I'm going to listen to your lungs now. I'm gonna have you take a deep breath in and exhale. And again, breathe in and exhale. Good. I'm going to listen to the sides as well. Breathe in and breathe out. And again, breathe in and breathe out. Okay. I'm going to check the skin on your arms, okay? I'm definitely noticing the scar here on the left elbow. I'm going to lift your arm up a little bit. Okay. I'm going to check the skin. We're looking for any raised bumps. Capillary refill is within 2 seconds.
splinter hemorrhages. So there is no palmar erythema. No signs of vitamin B deficiencies. Just going to go ahead and check for any raised bumps. There's one right here on the right elbow. But it looks normal in size and I'm not seeing any abnormal discoloration. I'm just going to write that in your file and take a look at it in a few months. Okay, we're going to take a picture of this and save it in your file.
Okay. Now we're gonna go ahead and check your legs. Just going to slowly palpate. Let me know if you feel any kind of pain. We're looking for asymmetry and changes in temperature. Checking beat pulses. Good peripheral circulation. Capillary refill is within 2 seconds. Normal temperature. And I'm not seeing any edema.
Okay. Again, we're checking to see if there's any skin moles, lesions that would require attention. There is one right here on your foot. We're going to go ahead and take a picture of that as well and keep it in your file. Just gonna watch it and see. Going to look in between your toes to see if there is any eczema. I'm going to do the Pinsky reflex here. Just relax. Good. And one more time on the left side. Good. I'm just going to have you push your pads towards you, okay? Towards you. Towards you. Like, so push your legs. Pull your legs towards you. Perfect. And now push with the pads away from you. Both of them. Okay, good. I'm going to slide my hands under your heels and go ahead and push. Okay, good. Now I'm going to try to push your legs down. I'm going to start with the right leg and don't let me do that, okay? Okay. Now try to other leg. That's perfect. Go ahead and listen to your belly. It's going to feel a little bit cold. You
And definitely just breathe normal. Going to percuss. And slowly I'm going to palpate. Let me know if you feel any kind of pain. Were you feeling some pain here?
No.
Okay. Going to go ahead and have you sit back on the table and we'll talk about the results.
Alright, I'm just going to go ahead and take off these gloves. And I took some pictures of a few spots that I thought they were a little bit concerning. Now we have them in your file and we're just going to compare them with 6 months from now. I'm gonna have you come back. Okay, so it's May, kind of like December.
Mm-hmm.
Okay. Perfect. Do you have any questions for me?
No.
All right. Thank you so much for coming in, and I'll see you soon.
Thank you.
Okay. I'm going to first take a look at the hairline. And today I'm going to do a scalp treatment as well. But the main focus would be scalp and hair. We're definitely looking for some inflammation and see if there's anything that we can do to detoxify and reduce any swelling. Taking a look at the base of the hair. I'm going to take some measurements first. I'm noticing a little bit of swelling. That definitely goes towards the center of the scalp. Just slowly tapping. We're looking for any neurological disorders, something that would definitely be shown in the main cranial nerves. I'm looking for any pulsations or changes. Taking a look at the skin, I'm noticing a little bit of flakiness, dry skin, something very similar to eczema. So we're going to look into a treatment to increase the gland secretion. So looking at circulation and see if I'm noticing any redness as I'm pressing down on the scalp. That could mean a lack of oxygenation. Okay, I'm gonna have you flip over. Okay, I'm going to go ahead and expose the hairline at the back of the neck. I'm going to go ahead and brush the hair. Seeing a little bit of redness at the base of the skull, and it looks like it's a scar. Any injuries?
No, not that I know.
It does look like you have natural wavy hair, and I'm not seeing any signs of alopecia at the base of the skull. Definitely going to take a look everywhere and see if there's anything abnormal. The skin is a little bit flaky. I was expecting this. I'm noticing some papules here and there. It's very similar to a light case of eczema. I'm going to take a sample and see if we're seeing anything abnormal. Okay. I'm going to touch you with 2 pressure points or 1. This is what 2 is going to feel like, and this is what 1 is going to feel like. Go ahead and tell me if you feel 2 or 1.
1. 1. 2. 1. 1. 2.
Now tell me if you feel this cold or warm.
Cold.
And now?
Cold. 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 Warm. Cold. Warm. Cold. Warm. 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 Warm.
Notice a little bit of redness here. Have you noticed any kind of itchiness on the right lower side of your scalp? I'm going to apply an essential oil that will help the muscles in the back of the neck to relax. I'm just going to go ahead and rub it. Make sure that it is absorbed properly by the skin. This will also help to reduce inflammation in the area and any redness. going to use sensory brushes to desensitize the area before we start massaging it. This will help to automatically increase blood flow. We're also focusing on the neck and upper back, spinal cord. This helps to decrease cortisol levels and balance the nervous system. I'm going to apply acupressure using pressure points at the base of the skull to release any toxins that have accumulated in the area. Focusing on the mastate bone as well. lotion that helps with any rheumatic pains. So it's targeting mainly the upper spine. Going to apply cold acupressure. So this is going to feel a little bit cold, okay? I'm going to perform hair pulling therapy. It's going to help with the trigger points in the back of the skull and to release any of that tension that you are currently feeling. releasing some of that tension that sometimes gets built up behind the ear. Hi, Casey.
Hi.
How are you feeling?
I'm okay.
We're going to do a full body assessment, and then I will see what kind of treatment we need to do. But you're here for a lymphatic drainage, full body massage, and I'm going to help you with detoxifying your muscles and helping to release some of that tension.
Okay.
I'm gonna have you first relax.
Okay.
You can go ahead and close your eyes, and we're going to start with 3 deep breaths in. And try to use your diaphragmatic muscles, which are more abdominal compared with thoracic, which you're doing right now. That's better. Okay, I'm going to do first just a gentle abdominal palpation. What this does is to kickstart the digestive system. It helps to stimulate enzymes that facilitate proper digestion. Okay. Now I'm going to focus on the scalp area. I'm going to have you lift your head up so that we can just rearrange the hair. Perfect. Also looking for any swelling. And I'm not noticing any redness around the scalp area. Today's treatment also helps with any asymmetries that you have on the body. So sometimes the musculature can be so tense on only one side, since the brain prefers to use more capacity, the right side or the left side. And by stimulating the nerve endings, we are allowing for both hemispheres to relax. This scalp stimulation technique also helps with face lifting, and it tonifies the muscle mass. Going to put gloves on. I'll start by assessing your face. Also looking for asymmetry. Noticing slight swelling on the right side. And the face does look a tiny bit asymmetric on the left, under the cheek. So I'm slowly going to assess the orbital fossa and sinuses that are situated right under the eyes. Palpating lymph nodes in front of the ears. We're also assessing for any fluid accumulated. Slowly palpating submental lymph nodes under the chin. And above the clavicle area. Going to use a neurological hammer to trace the skin and see if I'm noticing any increased swelling. This is skin tracing technique. It's very useful in identifying those spots that need to be focused on. Looking for any blanchable edema redness or puffiness, and that could indicate lymph fluid that has been stuck under the skin. Going to apply a detoxifying oil. I'm going to start with the neck and arms. This is going to feel a little bit warm in the beginning. Just going to put the straps a little bit on the side. Okay, this is going to feel a little bit cold. This helps to stimulate nerve endings and decrease inflammation. The roller is very gentle and just slowly pushes the skin and applies gentle pressure. Going to use cupping therapy to stimulate blood flow. This also helps to detoxify muscles and lymph nodes. Alright, I think we can go ahead and move down. Okay, warming up the oil. The cells to reduce inflammation, and it facilitates lymph drainage. So you'll definitely notice a flatter stomach and less bloating. This is going to feel a little bit cold. We're applying cold therapy. This helps to decrease tension in the abdominal muscles. Just slowly applying pressure point therapy on the soles of your feet. This helps to balance the musculature. And any inflammation that you are having that's coming from the feet, we're definitely covering it now and making sure that we are balancing and increasing mobility. Okay, I'm gonna have you turn on your belly and we're going to work on your calves now. Okay, applying the same anti-inflammatory oil, focusing on the calves. This helps to increase immunity and circulation in the whole body. Okay, using cupping therapy to first detoxify, and after that we're going to perform lymphatic drainage. This is definitely a longer treatment. Sometimes we just like to focus on certain parts of the body instead of doing a full body. But in today's session, I decided that it would be better to first start with all the parts. That way we can help you reach the goal that you want in a faster session. And then on your time, I'm going to allow you to wake up. How are you feeling? A lot better. Thank you. You're welcome. Thank you for allowing me to do this massage, and thank you for coming.
Thank you.
Hi, Nikki.
Hi.
My name is Dr. Mad. How are you doing today?
I'm doing well, thank you.
Wonderful. I see here that you're in for a head-to-toe examination. When was your last checkup?
Over a year ago.
Okay. Can you please verify your last name?
Yes, Mar, M-A-R.
Okay. And your date of birth?
June 15th, 1998.
Okay. All right. Do you have any allergies?
No, just normal dust and pollen.
And are you taking any medications?
I take allergy medication and an asthma inhaler.
Okay, perfect. So now we're going to go ahead in the medical history. You do have asthma?
Yes.
How long ago were you diagnosed?
4 or 5 years ago.
Okay. And when was your last episode?
3 months ago.
Were you okay with the inhalers that you have, or did you have to go to the emergency?
No, the ones I have work.
Perfect. Okay, and the medication, is it PRN or you have to take it on a daily basis?
It's daily.
How many times per day?
Twice a day.
Okay. Do you have hypertension?
I don't.
Okay. Any digestive problems? Nausea?
No.
Are you experiencing any headaches, confusion?
No, nothing like that.
Okay. And do you wear contacts right now?
I do.
Okay. When was your last vision checkup?
6 months ago.
And have you noticed any increase?
No,
It
everything
stayed the same?
Yeah.
Right. Any bumps or anything abnormal on the skin that you would like me to check in particular?
No, not that I know of.
Any pain right now?
No pain.
So on a scale of 0 to 10, how would you rate the pain? 0. Perfect. No, that's exactly, I know it's redundant, but I just want to make sure.
Mm-hmm.
Any hospitalizations?
No.
Any injuries?
No.
Okay, let's talk about family history. Anything from maternal or paternal side of your family? Any endocrine disorders, hypertension?
My mom's side has high cholesterol. My dad's side has type 2 diabetes and hypertension.
Okay. Alright, let's go ahead and take your vital signs. Okay, I'm going to check your blood pressure. Is the left arm okay? relax. Blood pressure is 108/65. Go ahead and slow this down. I'm going to check your pulse. I'm going to put 2 fingers around your wrist. Okay, pulse is strong and symmetric on both sides. No signs of heart failure or any cardiac congestion. I'm gonna go ahead and listen to your heart. So I'll have you breathe normal. I can hear only S1 and S2, no S3, no S4. Now we're going to listen for murmurs. Can you go ahead and take a deep breath in and hold it in for 1, 2, 3. Breathe out. Very good. I'm going to listen to your lungs as well. Take a deep breath in and exhale. Good. One more time. Take a deep breath in and exhale. Okay. I'm going to listen to the sides. I'm just going to lift your arm up a little bit. Breathe in and breathe out. One more time. Breathe in, breathe out. Okay. And now we're going to listen to your carotid. So that's going to be placed on the side of your neck. Go ahead and take a deep breath in for me and hold it for 1, 2, 3. Breathe out. And same thing on the other side. Alright, breathe in and hold it for 1, 2, 3. Breathe out. Alright. No distension there. Okay. I'm going to take the head circumference. That's exactly 60. Slight asymmetry. Okay, go ahead and keep this arm straight. 71. Okay. Alright, I'm gonna have you cover one eye now, and with the other hand, go ahead and hold the Snellen chart. I'm gonna have you extend your arm all the way, and can you read this row starting with the first letter to the left?
C, F, D, H, J.
Okay, and now the last row.
L, T, E, P, H.
Okay, go ahead and switch. So now I'm gonna ask you to read this row starting with the first letter to the right.
J, H, D, F, C.
And the same thing starting with this letter.
H, P, F, T, L.
Alright. I'm going to check your optic nerve. For that, I'm going to ask you to look behind me straight at the wall. And I'm going to shine a light in your eyes. Just try to keep your eyes open as much as you can, okay? Okay, I'm not seeing any inflammation behind the retina. Let's go ahead and check your ears. Have you noticed any inflammation or any abnormal discharge coming from the ears? No. Okay. I'm going to have you look that way for me. Okay, go ahead and relax. Tympanic membrane is broke, right? There's no signs of inflammation. Okay, there's no redness here. Just a little bit of extra earwax, but I'm able to visualize the tympanic membrane and it looks good. Okay, I'm going to do a mouth exam. Go ahead and give me a big ah. Okay, and is it okay if I do a dental checkup as well?
Sure.
Okay, so what I'm going to do is I'll slowly tap on each tooth. Let me know if you feel any kind of pain or sensitivity, okay? Right, perfect. When was your last dental checkup?
In November.
Okay. I'm going to put that tuning fork behind your ear. Can you please tell me when you don't hear it anymore?
There.
Okay. Go ahead and close your eyes. Go ahead and tell me when you don't hear the sound anymore.
There.
Okay. Now I'm going to put it in two positions. One is going to be louder. Go ahead and tell me which position here is louder for you.
Okay.
This is position 1. And this is 2.
2.
Okay. And this is position 1. And this is 2.
2.
Okay. I'm going to check patency of both ears. Go ahead and breathe in, breathe out through your nose. And again. Okay, you're breathing a little bit better on the right side. Let's go ahead and check for deviated septum. Can you look up for me? Okay. Everything looks good. I'm going to have you close one ear, whichever you want. And go ahead and breathe in and let me know what this smells like.
Kind of like mint.
Okay. And we'll do the same thing on the other side now.
Peppermint.
Both of them. Okay. And now I'll put a drop on your tongue. Go ahead and tell me if you can taste this.
Taste anything.
Okay. I would like to do a back exam just to check your neurological assessment and see exactly what's going on, because you did have some difficulty recognizing the smells and the tastes. Alright, so I'm going to have you turn towards the wall. Perfect. Okay. I'm going to go ahead and put your hair up. I'm going to start palpating, starting with the neck area.
Okay.
I am noticing a little bit of an eczema. Were you aware that you have this on the back?
Yes.
Okay. How long have you had this?
About 1 month.
A month. And do you know what could have caused it?
I don't.
Okay, were you recently at the beach?
No.
Okay, have you had any hair treatments done?
Yes.
Okay. I'm just going to go ahead and measure it. Does it hurt or does it burn?
No.
Did you try applying any lotion to see if it goes away?
I have.
Okay. Do you think it was a little bit bigger and it got smaller?
I think it stayed the same.
And when you first noticed it, was it painful, itchy, burning?
Just itchy.
Itchy. Okay. I'm going to go ahead and take a sample and send it to the lab to see exactly if it's a fungal infection or part of the allergy. I would say it's more allergy induced, but we definitely want to make sure that we are very thorough. This is just an alcohol swab to make sure that we're cleaning the area properly before we take a sample. Does it hurt?
No.
Okay, we're going to send this to the lab. I'm going to tap on your spine. Let me know if you feel any kind of pain. We're trying to see if there's any neurological response. So we're looking at muscle twitching, any kind of sudden movement. Can you go ahead and tell me if you feel this on the left or right?
Okay. Left. Right. Left. Right. 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 Right.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
There. There.
Okay.
There. There.
Okay. Go ahead and tell me if this feels cold or warm.
Cold. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Cold. Cold. Warm.
Okay, definitely more sensitivity on the right side. I'm gonna go ahead and check your skin. We're looking for any elevations. I need to check hydration status, so that's just gonna be a little bit of pinching. I'm going to touch you with 1 or 2 pressure points. I'm gonna need you to tell me if you feel 1 or 2. This is what 2 is going to feel like. And this is what 1 is going to feel like. Okay?
2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2.
Okay. I'm gonna have you lay down now and I'll examine your scalp and your abdomen. Okay, and again, I'm just going to take a look at your scalp. Mostly I'm interested to see if there are any skin issues like the ones that we saw on your back. Not seeing any dandruff. No signs of inflammation. I did see some red patches here. I'm just going to go ahead and see if they're elevated. They seem to be pretty isolated, so that's good. No discharge. Go ahead and tell me if you feel this 1 or 2.
1. 1.
What about now?
1. 1. 1.
I do see some signs of eczema. Some redness here on the right side. Okay, 1 or 2.
1. 2.
Go ahead and tell me if you feel this sharp or dull.
Sharp.
Sharp or dull?
Dull.
And now?
Dull.
And now?
Dull.
I'm going to check your abdomen. Okay, to go ahead and listen to your abdomen. And as I'm doing that, I'm just going to check for any asymmetry as well. I'm not noticing any skin lesions, any protrusions. Bowel sounds are diminished on the left side. I'm going to percuss. Let me know if you feel any kind of pain. Good. I'm going to slowly palpate, looking at liver size. Organ doesn't seem to be enlarged. I'm not feeling any cysts on the right side. Checking right ovary, lightly pressing down, and compare it with the left. No pain. It doesn't seem to be swollen either. I'm going to slide a hand under. Good. Relax. Same thing on the right side. We're checking kidneys to see if there's any referred pain. Okay, very good. Alright, I'm gonna have you put your pants back up. Okay, Nikki. Go ahead and try to bring your toes towards you. Okay, a little bit more. I'm gonna try to push. Don't let me do that, okay? Perfect. And now try to push with your pads towards me. Okay. And I'm going to slide my hands under your heels. Now I'm going to have you push with the heels, both in the same time. Very good. Okay. So symmetric on both sides. I have no concerns. I'm going to go ahead and check your Babinski reflex. Let me know if you feel any kind of pain, but you shouldn't. Okay. All right. Can you please tell me if you feel this on the left or right?
Left, right, left, right, both.
Checking capillary refill within 2 seconds. And checking pedal pulses as well. 2 plus. Symmetric on both legs. Good. Temperature seems to be normal. They're room temperature. They're not too hot, not too cold either. I'm going to check for pedal edema. And now I'm going to ask you to kind of like spread out your toes. Okay, I'm going to try to close them. Don't let me do that. You can relax this foot. Okay. Also looking in between the toes to see if there is any dryness. Looks good. Okay. I'm gonna have you sit back up. Okay. Alright, everything looks good. I do have some concerns though. We're gonna send you to get a CT of the head and neck. I do want to check that lesion a little bit better and make sure that there's nothing concerning. So I'm gonna have you scheduled for a follow-up in 2 weeks, and we're going to discuss the results of the CT as well, okay? Do you have any questions for me?
I think I'm good.
All right. It was very nice to meet you. I'll see you back soon.
Thank you.
Hi, Alice. It's very nice to see you again. I see here that you're having some problems with numbness on your skin.
Yes.
All right, before we begin with the exam, can you please verify your first and last name and your date of birth?
Yes. Alice Smith.
Okay.
May 10th, 2000.
Okay. Do you have any new allergies?
No.
And when did this begin?
About a year ago.
Okay. And they come on gradually. Are they all over? Is there a specific spot that is more numb than the others?
It's kind of everywhere, all over.
Okay. I'm going to take a look first. Do you take any medicine on a daily basis?
No.
Any vitamins that I should have on file?
Just a multivitamin.
Okay. And have you noticed any changes in your vision?
Slightly, yes.
Okay. Is it in both eyes or just one?
Both.
Both eyes. Okay. Any blurriness?
A little bit.
Any changes in your smell or taste?
Yes.
And any changes with your hearing?
No.
I'm going to go ahead and just start the exam. I'm going to first put some gloves on and we'll take your vital signs. Are you experiencing any pins or needles in your extremities? Okay. I'm going to take your temperature. This will go on your forehead. Let me fix that. Okay. 96.6, that's good. And I'll take your blood pressure. This will go on your upper arm. Okay, relax. So we'll go on the elbow. pressure is 120/70. That's normal. Good. Are you experiencing any headaches? I'll put this here. I'm going to first check your nose, since you did say that you're having some smell problems. I'm going to have you look up for me. I'm not noticing any redness, so that's good. Now I'm going to go ahead and check patency. Go ahead and breathe in and breathe out. Good. Breathe in, breathe out. Good. I'm going to have you try to identify the smell. Peppermint. Okay. That's normal. What about this one?
Spearmint.
Okay. That was sage. Let's go ahead and try one more.
Sandalwood.
Okay, that was like a lemon citrusy. So there's definitely something there. Let's go ahead and check your mouth. I'm gonna have you give me a big ah. We're looking for asymmetry, also redness or swelling. I'm not noticing anything abnormal. Can you go ahead and push your tongue up and down for me? Good. And side to side. All right, that's good muscle coordination. Now I'm going to put this tongue inside your tongue on one side of your cheek. I'm going to have you try to push it, okay? Go ahead and open. And now try to push the blade. That's good. Let's go ahead and do that one more time. Perfect. Okay. And can you give me a big smile? Okay, that's symmetric. And frown. Puff your cheeks. I'm going to have you keep them puffed. Don't let me unpuff them. Good. Relax. Now I'm going to have you shrug your shoulders. Good. And squeeze my fingers. Good. I'm going to have you put your arms like this in front of you. I'm going to try to push them down. Don't let me do that. Okay. I'm going to try to open them. Don't let me do that. Okay. I'm going to try to push them up. Don't let me do that. Okay. Good. Relax. And I'm going to put one drop of this on your tongue. I'm going to have you identify the taste, okay?
Minty.
Okay, that was just a sweet taste. So definitely there's some abnormality with cranial nerves, and we're going to go ahead and just continue and see exactly what we have here. Let's go ahead and check your vision. Do you wear contacts? No. Okay. I'm going to have you look behind me straight at the wall. Good pupillary response. I'm going to press down on the eyelid. Okay. Now I'm going to have you look right here. And look right here. Okay. I'm going to have you cover one eye. And can you go ahead and read the first sentence?
Hold chart 6 feet from eyes in good light.
All right, go ahead and switch. And read the second sentence.
Check eyes separately, not with and without glasses.
Okay, that's perfect. And what color do you see here?
Red.
Okay. Vision is intact. I'm not noticing anything abnormal. All right, I'm gonna have you now lay down and we'll examine your scalp. I'm going to just take the hair and put it on the side here. Starting with the side. I'm looking for skin issues first. I'm noticing a little bit of dandruff. And some redness. But otherwise, there doesn't seem to be any lice infestation or raised papules. Go ahead and tell me if you feel less pressure here.
Yes.
What about now?
No.
And what about here?
No.
Okay, so you don't feel anything on that side. Any pressure here?
Yes.
Okay. I'm going to touch you with just above of ear. Go ahead and tell me if you feel this, yes or no.
No. No. No.
And now I'll touch you with a sharp or dull texture. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
And do you feel this cold or warm?
Cold.
What about now?
Warm.
And now?
Warm.
And now?
Cold.
Okay. Go ahead and tell me if you feel this pressure point here
Yes.
and here.
Yes.
What about here?
No.
I'm seeing a little bit of redness here on the side where you don't have any feeling. Go ahead and tell me if you feel 2 pressure points or just 1.
2.
Do you feel this sharp or dull?
Dull.
And now?
Dull.
And now?
Sharp.
What about now?
Dull. Sharp. Dull.
Okay, go ahead and tell me if you feel this puff of air, yes or no.
No. No. No. Yes. Yes. No.
Okay. Go ahead and tell me how many taps you feel, 1 or 2.
2. 1. 1. 2. 1. 1. 1.
Do you feel this pressure point here?
No.
What about here?
No.
And here?
Yes.
Does this feel cold or warm?
Cold.
And here?
Warm. Warm. Cold.
Okay, go ahead and tell me if you feel this 2 or 1 pressure points.
2. 2. 1. 1. 2. 2. 2. 1.
Does this feel sharp or dull?
Dull. Sharp. Sharp.
Okay, do you feel this all the way?
Yes.
What about now?
No.
And now?
No.
Go ahead and tell me if you feel this pressure point here.
No.
What about here?
Yes.
And here?
Yes.
And here?
Yes.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold.
Good. And here?
Warm.
And here?
Warm. Cold.
Okay, so it looks like around here we're gonna be focusing Go ahead and tell me if you feel this. 2 or 1 pressure points.
2, 1, 2, 2, 1, 2, 1, 1.
Okay. And do you feel this sharp or dull?
Sharp,
And now.
dull, dull, dull.
Okay. Go ahead and tell me if you feel this all the way down.
Yes,
And now.
yes,
And now.
yes.
Go ahead and tell me how many puffs of air do you feel? 1 or 2?
2, 1, 2, 2, 2, 2, 1, 1.
Okay. Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp,
And now.
dull,
And now.
sharp, sharp, dull, dull, sharp, sharp.
And does this feel cold or warm?
Cold, 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 warm, warm, cold, warm, warm, cold, cold.
Okay. Let's go ahead and take a look at your back now. I'm going to first palpate the spine, looking to see if there is any abnormal curvatures, as well as any inflammation around the vertebrae. I am noticing a little bit of redness that shows some constriction in the blood vessels. for any pulsations or changes in skin texture. Just slowly tapping on the spine. Looking for abnormal neurological responses. I'm going to touch it with a cold texture. Go ahead and tell me if it changes in intensity.
Yes.
And where did you feel it colder?
At the top. Yes. No. Yes.
And where did you feel it colder?
At the bottom.
Was that the same?
Yes.
Go ahead and tell me if you feel this pressure point, yes or no.
No. No. Yes. No. Yes. No. No.
I'm going to touch you with dull textures. Go ahead and tell me if you feel this on the left or right.
Right. Left. 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 Right. 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 Left.
Now I'm going to touch you with two textures. One is going to feel dull. This is what dull is going to feel like. And the other one is going to be a little bit sharp, like this. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. 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 Sharp.
And I'll touch you with a wet or a dry texture. So go ahead and tell me if you feel this wet or dry. Now I'm going to touch you with 2 sensory brushes. Go ahead and tell me if it changes in texture or intensity as I'm sliding it down.
Yes.
Okay, where did you not feel it?
In the middle.
In the middle. Did you feel it all the way?
Yes. 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 No.
Where did you not feel it?
In the middle.
In the middle.
Yes. No.
Okay, Alice. Just checking your lymph nodes to make sure that they're not constricting any nerves. Sometimes if they're swollen, that could happen and could trigger a series of symptoms. Just gently palpating to see if there is anything concerning. I'm going to check for any TMJ disorders. Go ahead and slowly open your mouth as wide as you can. And slowly close it. Let's go ahead and do that one more time. And slowly close it. Okay. I did not feel any clicks. Did you hear any popping in your ears?
No.
Alright, I'm going to touch you on your face. So we're checking for any sensory problems again. Go ahead and tell me if you feel this on the left or right.
Right. Left. Right. Left. 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 Both.
Did you feel that equally on both sides?
Yes. Both.
And did you feel that equally on both sides?
Yes. Equally. Equally.
Okay. Go ahead and tell me if you feel this pinch here.
No.
What about here?
Yes.
Okay. Let me know if you feel this pinch here.
No.
And here.
Yes.
Okay, so it's more localized on the left. What about here?
No.
Here.
No.
Here.
Yes.
Here.
No.
Here.
Yes.
Right here.
Yes.
Here.
Yes. Yes.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
I don't feel it.
Tell me when it stops.
It stopped. 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 Stopped.
Go ahead and tell me which position here is louder, 1 or 2. This is 1 and 2. 1 and 2.
2.
Okay. I'm going to touch you with 2 pressure points. Go ahead and tell me if you feel this 2 or 1.
2. 2. 2. 1. 2. 2. 1. 1. 2. 2. 2. 1. 1. 2. 2. 1. 2.
And now I'm going to touch it with a sharp or dull surface. Let me know if you feel this sharp or dull.
Dull. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull.
Now go ahead and tell me if this feels dry or wet.
Wet. Dry. Wet. Wet. Dry. Dry. Wet. 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 Dry. Wet. Wet. Dry. Dry.
Okay, so it does seem like the dermatomes on the left side, more like in the middle, are compromised. I'm going to go ahead and check your arms now, and then we'll move down to the leg area. Go ahead and tell me if you feel this equally on both sides.
Yes. Yes. Yes.
Okay, I'm gonna have you flip your arms like that. What about now?
No.
Okay. Where do you not feel it?
On the left.
On the left. What about now?
No. Yes. Yes.
Okay. So we're going to focus on those parts. Go ahead and tell me if you feel this bubble there, yes or no.
No. Yes. No. No. Yes. No.
Okay. And does this feel cold or warm to you?
Cold.
And now.
Warm. Cold. Cold.
Go ahead and tell me if this feels sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Does that feel cold or warm?
Cold.
And now.
Warm. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp.
Okay. So go ahead and check your reflexes here. Okay. Relax your arm. Okay. I'm going to check your reflexes here. So I'm going to slide my arm right under your knee. Go ahead and relax. Good. A little bit of diminished reflex on the right side. Okay. Relax. Good. Okay. Very diminished on the left side as well. And now go ahead and relax your foot. We're just going to put it on top of the other one. Perfect. And okay, good. Same thing on the other side. Okay. I'm also gonna check Babinski reflex. Good. And we'll do that one more time on this side. Okay. And go ahead and try to pull your feet towards you, okay? Good. Now try to push with the pads. Okay. Go ahead and try to open your toes. Okay. Try to curl your toes around my fingers. What about the big toe? Alright, very diminished on the right side. Go ahead and tell me if you feel less puff of hair.
Yes. No. Yes. Yes. No. No.
Does this feel sharp or dull?
Dull.
And now?
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay. So cranial nerves are honestly all over the place. I'm gonna have you stand up and we'll talk about what we should do next. All right, Mrs. Smith, we're going to just order a few more tests. We're going to do a CT scan. We're going to check abdomen and neck and head. Now, I'm going to prescribe some medication as well. I think it's going to help to bring down some of the inflammation that you're experiencing in some areas of your body. And you might experience a little bit of side effects. Those are normal. I'm going to go ahead and write that down for you so that you, in case you do experience that, you don't get alarmed. And let me know if you have any questions for me, okay?
Okay.
All right.
Thank you.
You're welcome. It was very nice to see you.